This is not good news. Many Americans are now facing record high levels of debt, but things may be getting worse for more seniors and retirees. Officials have confirmed that more than half of older Americans are stuck in Medicare Advantage plans. Experts say that these plans have negative effects that many do not know about. My dear friends, please make sure that you watch until the end of this video. Also, in a video later today, I will be announcing several winners for the Walmart gift card giveaway. If you would like to enter the weekly giveaway, friends, please click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning the giveaways.
I want to first echo some concerns that I previously highlighted before this committee related to government overreach and overregulation. We've seen it across the board. In all financial institutions, they're bringing, the regulators are bringing, under this administration, more regulation, more overreach, more burden, and unfortunately, the Federal Insurance Office is no different. In November, the Treasury Department announced that it's moving forward with FIO's climate data call, and this is just yet another blatant effort to overstep into the state-regulated insurance industry and collect incredibly detailed information from our communities. The effort completely undermines our well-functioning state regulatory system and is an effort to pursue this administration's climate agenda at the cost of both taxpayers and industry. That's why I introduced the Insurance Data Protection Act with 16 of my Senate colleagues, including all of the Republican Banking Committee members. The bill would rein in the overreach we have seen from the Federal Insurance Office and keep the office as it was intended to be, an informational body that supports the efforts of our state insurance regulators. State insurance regulators understand the unique needs, including the weather challenges faced by their communities, and they help drive solutions. Unfortunately, Alabama is no stranger to the impacts of our natural disasters. We've experienced the devastation of everything from tornadoes to hurricanes to major weather events and everything in between, the effects that those have on families, homeowners, and communities. Even this week, we are preparing for strong storms and flash flooding across southern Alabama. It is imperative we are forward-thinking in our disaster mitigation, disaster preparedness, and resiliency efforts. The Alabama Department of Insurance, in particular, has been a champion in this space. In 2011, Alabama established the Strengthening Alabama Homes program, designed to aid and incentivize Alabama homeowners to improve their homes and to minimize property loss due to weather events. Mr. Kanuski, I appreciate you highlighting these efforts in your written testimony. You specifically touched on the Fortified Roof program that we have in Alabama and a report by 3 universities that studied the demonstrated benefits of the program. In short, the study found that the program directly resulted in 1, lower insurance premiums, and 2, higher home resale values. For those that may not be aware of the efforts in Alabama, can you further describe them and touch on the proven benefits that they have to homeowners?
Well, thank you, Senator. And I got to say, in many forums, I often laud Alabama. Alabama has 3 really notable things that you touched on. 1, they have a resilience council. They created a council, and you say, oh, the council, big deal. No, it is a big deal because it meant the governor is prioritizing resilience. Moreover, the co-chairs of that council are the state emergency manager and the state insurance commissioner. In some states, those 2 don't even speak. In Alabama, they sit together and they work on these resilience issues jointly. So kudos number 1. Kudos number 2, Strengthen Alabama Homes, as you mentioned. That program has been so successful that other states are now replicating it. Louisiana is now putting it into place, a virtual carbon copy of what Alabama put in place. And your state insurance office is working very closely with the state of Alabama to help them implement that program. So again, kudos. 3, the study you mentioned. You're lucky to have a researcher named Lars Powell at the University of Alabama who did that study. I thank Lars any opportunity I have, because that is the first study that I've seen that gives empirical data, real evidence that mitigation pays.
According to Yahoo News, roughly 1/3 of Americans say they have higher balances on their credit cards than they do on their rainy day funds. The worrisome percentage points to why so many people remain gloomy about the economy despite cooling inflation and low unemployment. A new study from Bankrate shows that 36% of Americans say they have amassed more credit card debt than emergency savings. That is the highest percentage of participants to say so in the 12 years since Bankrate added the question to its annual survey. 63% of U.S. adults point to inflation as a main reason why they are unable to save for the unexpected. Mark Hamrick, the senior economic analyst at Bankrate, said in a recent statement, "Inflation has been a key culprit, standing in the way of further progress on the savings front. Fortunately, rising interest rates have also provided more generous returns on savings. But rising interest rates can also hurt finances, as is the case with credit card rates, which have increased over the past year." Among survey respondents, 45% say rising interest rates are behind their lower savings account contributions. Despite those rising credit card rates and ballooning balances, 21% of Americans say they would resort to using their credit cards to cover an emergency expense of $1,000 or more and pay it off over time. But they do so at the risk of falling farther behind on their financial goals. Nearly 1 in 4, or 22% of respondents, reported they have no emergency savings at all. That is a 1% decrease from the 23% of Americans last year, who also found themselves in the precarious position of having no emergency savings. Mark Hamrick added, "Anyone with no such savings, including those without access to credit, risk tremendous stress, or worse, on their personal finances when hit with a significant unplanned expense, such as a major home or auto repair." Also, friends, according to Newsweek, in 2023, more than half of seniors were enrolled in Medicare Advantage plans. For many seniors, the plans had some serious problems they only learned of later on. Ads often boast better prices and a wide range of services, leading many seniors to quickly decide to switch to a plan that saves them more money up front. But according to a Senate Finance Committee report by Oregon Democratic U.S. Senator Ron Wyden, customer complaints about Medicare Advantage's marketing skyrocketed to double from 2020 to 2021, bringing the total to 41,000. Such plans tend to have small networks where specific services require prior approval, thus delaying treatment. Seniors, especially when their health degrades more, they feel like they are stuck in these plans. While CMS responded by outlining new rules against Medicare Advantage plans, the organization did not ban list acquisitions from third-party Medicare Advantage marketing organizations. According to Newsweek, those who need expensive medical care and Medicare Advantage often have to wait for prior authorization approval, which adds on obstacles to their health care, something the marketers never mention. 1 in 5 seniors reported issues getting medical care due to the prior approval process, and this is according to a recent retirement living study. Another study found half of beneficiaries switched to a different plan after 5 years. The marketing practices often go a step further when it comes to those eligible for both Medicare and Medicaid. Experts have also said that Medicare Advantage marketers often neglect to explain that low-income seniors are also eligible for the program. This is usually more expansive and covers more health conditions and treatments. Well, my amazing and most awesome friends, that is the end of my daily stimulus update video for today. My dear friends, thank you so much for being part of this community. I will be announcing several winners today for the Walmart gift card giveaway. If you would like to enter the weekly giveaway, friends, please make sure that you click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning those giveaways. Thank you and have a wonderful and very blessed day.